Hi, my name is Morgan and I'm going to be doing a HOFA video today with my assistant Justin, and we're going to be doing an assessment. I'm going to be doing an assessment on him of his head, neck, ears, eyes, nose, and mouth. Okay, so I'm the nurse. Okay, so I would start by knocking on the room, him saying it's okay to come in. I would come in, I would provide him with privacy. I would wash my hands. And then I would check his ID badge for 2 identifiers. Can you tell me your first name?
Justin.
What's your last name?
Green.
Why can't? What's your birth date, sir?
9/6/69.
Okay, all right. So now as I assess, I'm just going to gather subjective data as I move on through the systems of the eyes, ears, and nose. Okay, so I'm going to start with the head by inspecting and palpating. I'm going to have you turn towards me a little bit. Okay. So have you ever had any sort of head surgery?
No.
Do you have a history of headaches?
No.
Are you experiencing any pain right now in your head?
No.
Have you noticed any lesions?
No.
Head injuries, concussions?
No.
Okay, so I'm just going to inspect and palpate. And if this wasn't my boyfriend, I would use gloves. Are you feeling any pain while I'm inspecting and palpating?
No.
I need to talk louder. Okay. Alright, I don't feel any lesions or any strange bumps. Everything appears to be normal. Okay. So, as I look at his face, everything is normal cephalic. His face is symmetrical on both sides, which would indicate that cranial nerve number 5, the trigeminal nerve, is intact. Next, I'm going to palpate his temporal artery to feel the pulse. The pulse is strong and bounding. Okay. Next, I'm going to palpate for his temporal mandibular joint, and I would like you to open and close for me. I didn't feel any clicks. Did you experience any tenderness during that? No? Okay. Alright. And then next, what? And then next I'm going to move on to your trachea. The base midline appears to be within the center of his body. There's no deviation. Okay. And then I'm going to feel for your thyroid. Can you turn towards this way for me? Nothing? Okay. And then I'm just going to, what? And then I'm just going to have you swallow. Just not till the eyes. Alright, and then I'm going to have you look at me again. Just not till the eyes, I have to say that. Okay. And now I'm going to palpate your neck for lymph nodes. Have you ever had lymph surgery before or any sort of problems with your lymph nodes?
No.
Are you experiencing any pain in your neck or clavicular region?
No.
No? Okay. Alright, I'm going to start with the pre-irregular lymph node, post-irregular lymph node, occipital lymph node, submandibular, submental, tonsillar, deep cervical chain, hard to feel, superior cervical. And then I'm going to have you take your shoulders and go like this for me. And I'm going to feel your supracervical clavicular lymph nodes, supraclavicular lymph nodes. Okay. Everything appears to be, you didn't have any pain when I was palpating?
No.
Okay. None of them felt swollen to me. Okay, so next I'm going to move on to your eyes. I don't feel like I missed anything. Okay. So I'm going to need a pen light to check his eyes and assess his eyes. Have you ever had any sort of eye surgery before?
No.
Are you experiencing any eye pain right now?
No.
Do you wear glasses or contacts?
No.
Okay. Alright, so I would dim the lights because I'm going to check his pupils for if they're equal, round, reactive to light, and accommodate to my pen light. So I'm going to start by taking this to the side, and I'm going to watch for his pupil to see if they constrict. This is hard for you, huh?
Yeah.
Okay, so that pupil was equal, round, reactive to light, and accommodating. Pupil was equal, round, reactive to light, and accommodating. Okay, then I'm just going to have you look at a point on the wall, and then I want you to look at my pen light, and then follow it. Okay, next I'm going to do your 6 cardinal gazes. Okay, I just want you to follow my pen light. Okay, cranial nerves 3, 5, and 6 appear to be intact. The external part of his eyelids appear to be symmetrical. Eyebrows are symmetrical. Anything else for me? Conjunctiva is pink, moist, clear. Sclera of the eye is white. Okay, so next I'm going to move on to your mouth, and I'm just going to inspect your lips for any sort of lesions and symmetricalness. Have you ever had any oral surgery before?
No. Yes.
Yes?
Yes.
What have
I've
you
had my
had?
wisdom teeth taken out.
Okay, how long ago was that?
5 or 6 years ago.
Did you have any problems?
Dry socket and infection.
Okay, but it was treated accordingly?
It was bad.
Okay, alright. So was that the bottom wisdom teeth or the
Yes.
top, or both?
Bottoms.
Just the bottoms?
Yes.
Okay, so we'll take a look at that when we look inside your mouth. So you don't have any lesions on the outside of his lips. So are you experiencing any pain in your mouth right now?
No.
Okay, I'm going to have you open your mouth for me. Okay, so the buccal mucosa is soft and pink. The soft palate is soft pink. The tonsils appear to be about a grade 1, and I am noticing a little bit of redness back there, and I can see that he's had some cavities done on the right side and the left side, 4 cavities, and I can see where he had his wisdom. You can relax your mouth. I can see where he's had his wisdom teeth removed. Okay, and I'm gonna have you stick your tongue out for me real quick. Okay, so cranial nerve number 12 is intact. Okay, you can close your mouth now. All right. Okay, so now we're gonna move on to the ears. Okay. So the external ear. Have you ever had any ear surgeries before?
No.
Are you experiencing ear pain right now?
No.
Okay. And no ear infections recently?
No. Just our kids infect them.
Okay. So I'm going to start by palpating the tragus. I'm going to lift the ears, and then I'm going to palpate the mastoid process. Do you feel any pain while I palpate the mastoid process?
No.
Okay, so the outside of the ear appears to be symmetrical. I'm just going to take a look really quick on the inside. And I can actually see your eardrum, and it's pearly gray.
Oh my god, did you see the light come through?
You're going to make me get in trouble.
Alright, go ahead.
I'm not starting again. Okay. Okay, so I didn't see any foreign objects. There was no drainage coming from his ears. Okay, so last, what? It doesn't matter. Okay, so the nose, I'm going to check his nose last but not least. I do notice when I'm looking at your nose that it deviates a little bit to the left side. Have you ever had nasal surgery?
No.
Have you ever had your nose broken before?
No.
Deviated septum?
No.
No sort of nose issues?
No.
Are you experiencing nasal pain right now?
No.
Okay, I'm just going to start by, I just want to palpate your sinuses before I begin. And let me know if you feel any pain. No pain?
No.
Okay, next, that was your maxillary sinuses. Now I'm just going to palpate your frontal. Did you feel any pain upon palpation?
No.
Okay, so now I'm going to take a look into your nose. Okay, so I do notice that it is red on the inside and there is a little bit of drainage. I don't see any deviation and it does appear to be symmetrical. Do you have a cold right now, sir?
Yeah.
Yes? Okay. All right, no fever?
No.
Okay. So I'm going to assess his cranial nerve number 1, the olfactory nerve, and I would have him cover one nair and then smell. Can you tell me, let's say we have coffee. I can get some, well, we'll just pretend. Can you smell that for me? What do you smell?
Coffee.
Can you smell this for me? What do you smell?
Coffee.
Okay, so cranial nerve number 1 is intact. Okay, so I think that's all of it. Thank you.